Hi, everyone. Welcome back to Staying Compliant with KW Advanced Consultant. My name is Keisha Wilson. I'm the founder of KW Advanced Consultant. So for the next few weeks, we're going to be talking about different parts of evaluation and management services. But first, I wanted to start off with one. I recently posted on LinkedIn, if it's not documented, it wasn't done. This is something that as coders and auditors, we hear oftentimes from the beginning of our coding career, right? And we oftentimes have to have this conversation with physicians and let them know, listen, if it wasn't documented, it wasn't done. If it's not in the record, if it's not in the documentation, it's like it never existed. And this is a conversation before we even start with documentation that we have to have with clinicians. You know, during a lot of trainings, I often ask them, if you were to leave the practice today and your colleague was to take over your patients, would they know exactly what's going on with each one of them? And they start to laugh and they were like, well, Keisha, we know the patients. I know my patient. I've been seeing this one for 20 something years. Um, I know their husband, I know all their kids, their grandkids' name and stuff, and it's like wonderful. But do you have everything that's going on with that patient documented in the record? And, oftentimes they'd be like, well, no, maybe not everything, but I know them. But anything can happen, in this life, right? We know that documentation is a legal record. So we need to understand the thought process. We need to know exactly what's going on with your patient. We need to know medical necessity, especially when you're ordering more tests. Why are you seeing the patient today? It has to be clearly documented in that record. And then when it is, then as coders and auditors, we are now able to review the record and then code it to the highest level of specificity. But oftentimes we look in the record and we don't see why the patient's there. If we're ordering more tests, it's really hard for us to give them detail because that information is not in the record. So this is oftentimes why you hear the statements, if it wasn't documented, it wasn't done. We can't make up these codes from thin air, right? It has to be clearly stated in the record. So, it's important to have these conversations with clinicians, with physicians, to let them know the importance and how we rely on their documentation. And it also is best practice. We have a clear understanding of medical necessity of why you're seeing the patient today. It's clear from the chief complaint, history, exam, medical decision making, what's going on here. You know, is the condition worsened? Did it get better? Did you change medication? What's going on with the patient? Why did you need to change the medication? What's the dosage of the medication? You're sending them to PT, OT, or second opinion. Why? What's going on with the patient? Why do you need to send them? So you just can't keep the thought process in your head. It needs to come out and roll onto the paper, as I mentioned, so that we can clearly understand what's going on with the patient, and then we can work together as a team and code these codes to the highest level of specificity. So remember, if you're looking at notes, if there's some ambiguity, if you see information is lacking and not there, have an open discussion, right? We're querying our physicians, but we're also having an open discussion because together we're a team. And so we need to let them know the importance of the documentation and the role that it plays when it comes to patient care, but as well as it comes to compliant documentation. So I hope this was helpful. I hope it opens up a conversation that if you're seeing the lack thereof in notes that you're reviewing, that you're able to have this conversation with the clinicians. So this was our little tip on staying compliant with KW Advanced Consultant. I hope it was helpful. I look forward to seeing you guys. Remember to like, subscribe, and share, and stay tuned for our next video.